All right, the digestive system. So this is chapter 15 in your book. So we'll go through the entire tube from mouth to anus. So food is never really inside you. It's always inside this food tube, which is also called the alimentary canal. So if you ever hear that word, it means the same thing as that tube from mouth to anus. Movement through the GI tract by peristalsis. Peri means around. So since it's a tube, the contraction is in a circular motion all around the tube. And then we'll talk about the accessory organs like the liver and the pancreas. So here are lists of the tube and the accessory organ. So if it's not part of the tube, right, from mouth to anus, then it's an accessory organ. So let's go over those guys. So saliva glands, those help you digest. They actually chemically break down food. Then you have your liver, right? It produces bile to help you absorb fat. And of course, all the nutrients is processed through the liver. The gallbladder makes the bile. Sorry, the liver makes the bile, but the gallbladder just stores it. So it's okay if you get your gallbladder removed, the liver is still making the bile. And then lastly, the pancreas. It's like a supercharged saliva gland where it makes all of your digestive enzymes. Right? They're going to break down food chemically. What's another term for pharynx? That's your throat. Esophagus is the food tube into your stomach, small intestines, and large intestines. So this guy is sometimes just called the colon. And then the rectum out to the anus. All right, let's go to the terms, some of the word roots. Stomato for mouth. So they use that term before if you study biology. Right? Plants have stomas, but that's for letting in gases and water. You go to the dentist to get your teeth fixed. To get them straight, where do you go? So ortho means straight, and odonto means teeth. So your orthodontist straightens your teeth. Gloss for tongue, aka lingual. Don't get that mixed with glot. Right? Remember, this is the place where your vocal cords are. Gloss is your tongue. Cilio for lips. Gingivo for gums. You guys probably heard of gingivitis. Right? Inflammation of the gums due to infection. And then the body parts are fairly easy. It's just shortened of the word that we use to describe the body part. Gaster for stomach. Enter is intestines. And then the first part of your small intestines is the duodenum. And it's only about a foot long, about 12 inches or so. The next part of your small intestines is the jejunum. And then the third part is the ileum. And then the colon is sometimes, or the colon refers to the large intestines, right? So poop goes up. So on the right side, poop goes up, ascending colon, and then poop goes over. That's called the transverse colon. Poop goes down, descending colon, and it does a little wiggle before it enters the rectum. So that wiggle is the sigmoid colon. And then out the rectum, out the anus. Would you shake hands with the proctologist? A proctologist? Would you shake hands with the butt doctor? It's okay, they wear gloves. The organs. Hepato, we already had. Chole, cyst. So cyst is just generic for bladder. Here they're using chole for the bile. And it kind of makes sense because bile absorbs fat, and the type of fat is cholesterol. Yeah.
So whenever it's like bile, I'll use the chole.
Yeah.
without the O or anything?
Uh, well, the E is the combining valve.
I get it.
Yeah, that's the combining valve.
Thanks.
Pancreato for pancreas, easy enough. Saliva for saliva. Here is showing the movement. So in your stomach, you got muscles this way, you got muscles going this way, and then all at different angles. So the smooth muscle will churn the food. So the acid in food now is called chyme before it enters the small intestine. Here we got mixing, so sloshing stuff back and forth. You see the yellow and the blue, and once it mixes enough, it's going to turn green. So you want a homogeneous mixture. And lastly, propulsion. So if you squeeze here, it's going to propel the object forward, and then you just squeeze in the next position to eventually move the object down the GI tract. So digestion begins in the mouth, both chemical and mechanical. So mechanical is just the physical breakdown. It's like cutting with your teeth, chewing. But the chemical breakdown is done with your saliva. Your saliva will actually break down food chemically. The term for mastication, the term for chewing is mastication. Can you guys point to your mastoid process? You guys remember that? So the muscle of mastication will attach at the mastoid process. Right? Your masseter is your muscle of mastication. We got throat and then the food tube. So we have to pass the air tube, right? So here's the air tube in front, right? The trachea. So in order for food to go down the food tube, the esophagus, it has to pass over. And we have that trap door, the epiglottis, to prevent food going in our air tube. All the bumps on your tongues are not the taste buds. They're actually papules. So they have different shapes. So they have different names for them. So flovite, some look like mushrooms, so they call them fungiform. The stomach. What type of muscle is the stomach made out of? Is it skeletal? Can you move your muscle? Is it cardiac? Is it heart muscle? No. Smooth. So because it's smooth muscle, it can actually overstretch. So it can actually get bigger than a liter. If it was striated muscle, like skeletal or cardiac, it'll actually rip if you eat too much. So there are some enzymes break down carbs and protein, but it's not until you have bile that you can actually emulsify the fats. The fundus. So fundus means dome portion or the top portion. And then the main portion is the body of the stomach. And then the lower portion is called the pylorus. So if I say fundus, you know that's the top portion. And then pylorus, lower portion. So this is a really weak sphincter here called your cardiac sphincter. All right, every time you burp, it opens up, right? So it can allow acid out as well. But this sphincter here, your pyloric sphincter, it's a lot stronger. More of a one-way valve. So that cardiac sphincter opens, you burp every time. Or if you lay down sometimes, it'll open up and you'll get heartburn. People with acid reflux disease or GERD, gastroesophageal reflux disease, they might have to sleep on an incline just to prevent that acid from going back up. The esophagus has no protection. So there's no mucus, no buffer. So if it burns, it can burn a hole right through, and then right next door is your, what's right next door right here? The heart. So you can actually burn a hole into your heart as well. Stomach juices, super acidic. When it mixed with food, it's called acid chyme. So that means the small intestines have to neutralize the acid. So the small intestine would be opposite of acid. It would be basic. The folds increase surface area. And this surface area is, of course, for absorption of the nutrients. Intro for intestines. What do you think E. coli is? So where does it live? It lives in the intestines, specifically in your colon, right? So enterobacter, so it's a intestinal bacteria, and this one lives in your colon. So E. coli. As long as it stays in your gut, you're okay. If it's found outside of your gut, that's when you get food poisoning, right? Duodenum, first part of the small intestine. Jejunum, second part. And then the ileum is the third part. So the acid, right, has to be neutralized. And as it goes through the GI tract, it becomes less and less acidic. And then when it exits, it's most of the time basic. So here is the duodenum. It's going to get all that acid in from the stomach, so it has to be basic to neutralize all that acid. Jejunum and ileum is a lot longer. And then what we have here is a little blind-ended sac, so called the cecum. And popping off is the appendix. So they call it the vermiform because it kind of looks like a worm, a vermin. And then poop goes up, ascending colon, poop goes over, transverse colon, poop goes down, descending colon, makes a little wiggle, sigmoid colon, and then out the rectum. So synonymously, colon. If you hear the word bowel, then that's generic for the entire small and large intestines. So everything is absorbed, all the nutrients is absorbed in the small intestines. All that's left is water and salt. Electrolytes are your salts. So a lot of blood supply. So this blood supply is called the mesentery, and it'll absorb all nutrients except fat. Because fat, as you guys recall last week, gets absorbed in the lymphatic system. The liver, it's going to make bile, but remember, it is just stored in the gallbladder. So that's why gallbladder surgery or removal is perfectly fine. So instead of getting a big old stockpile of bile, your body's just going to slowly release it in the intestines, into the intestines throughout the day. So that means you cannot eat a large fatty meal because you don't have that stockpile to deliver. So smaller meals, less fats. So here is the image. So on the underside is where the gallbladder is positioned. Pancreas serves both endo and exocrine function. So for hormones, that's endocrine. For us, digestive juices and digestion, it's going to be its exocrine function. So via a duct, the pancreas is going to dump its enzymes directly into the duodenum, the first part of the small intestines. So here we have a common bile duct, the gallbladder, the bile from the gallbladder, and the pancreatic juices will join together. Now those enzymes, since they can dissolve food, they can actually dissolve your body as well. So if you get a blockage, all those enzymes will back up, and then that might even dissolve the pancreas itself. So if there is a blockage, that's a medical emergency. the procedure of looking in your intestines. So they can insert it just to the esophagus, then they can go into the stomach, and they can advance it all the way into the first part of the small intestines, the duodenum. They had some issues with sanitizing these endoscopes, and they were infecting patients because they weren't completely sterilizing them. Because there's a camera, there's a swivel camera, and all those small parts, really hard to clean. Some disorders, bulimia, so you eat and you purge, and then we have anorexia. So this is more of starvation, and they might view in the mirror, they might see a fat person even though they're skinny. So it is a psychological disorder. Between the two, eating, throwing up, or not eating at all, which one is more unhealthy? Yeah, this is worse because your body's starting the digestion. It puts a lot of investment in, a lot of energy, a lot of nutrients, vitamins, and mineral, and then you don't get your investment back. You're not absorbing the nutrients, you're just throwing it back up. In anorexia, as long as you get your calories, and a lot of times it's just fluid calories, they're giving you sugar water or something, it's just a slow malnutrition. So kind of in between, have you guys heard of chew and spit? Mm-hmm. So it's usually with the sweets, sweet foods. Again, they don't want to get the calories, but they still want the pleasure. So they'll chew the food and then they'll spit it. And usually they'll take like a big gulp cup, they'll carry it around with them, and they'll spit it into the straw, just like they were dipping all day. So the one pocket, they'll have like Oreo cookies, they'll chew it, get the pleasure, and then they'll spit it back in the cup. And if you have teenagers with a bunch of like throw up smelling bottles around, that might be a sign of chew and spit. Secondary to other problems. So if you have a condition that now affects the GI tract, then that's secondary. So for example, mouth sores. So it could be caused by herpes virus, HPV, or an infection. You guys ever had like the patch? You guys heard of the patch? The tongue patch? T-O-N-G-U-E. Spell that. So to lose weight, they put this spike patch on your tongue, and it makes it painful to swallow. So people will tend to eat less. So if you're getting married in 6 weeks, they'll surgically sew the patch on their tongue. It's hard for them to eat for a while, and then they lose the weight, and then they take the patch off. So it's better than getting your stomach stapled or a gastric bypass, because that stuff is more permanent. So sometimes if you have a sore in your mouth, you don't want to eat because it's painful. Like a sore throat, sometimes you don't want to swallow. Difficulty, painful indigestion, pepsia. So Pepsi Cola. So the Pepsi is for digestion. The cola is actually an ingredient. It's from the cola nut. So they just named it after what they used to make it. So all your sodas were medicine, right? So Dr. Pepper, what's that for? What was Coke used for? So a lot of upset stomach, indigestion, right? Sip the soda, it'll help relieve it. Tonic we already talked about. It contained quinine that helped malaria. And then 7-Up, right? 7-Up elevates your mood. It used to contain lithium for bipolar. Well, no, not anymore, unfortunately. Because adults, if you don't want to be a depressive as an adult, then you need adequate lithium. Ulcers.
Why do people have like these like Pepsi and these Mountain Dew addictions?
Sugar. Sugar is crack. So sugar gives you the same response as crack cocaine in the brain. You're addicted to the sugar. Sugar gives you the energy, but then you get that insulin spike and it slows you down. So it depends. Like children, they'll be hyper because they're going to burn it and use it. Adults, it might slow you down because of that insulin spike. So be careful. Sugar is crack. Ulcers. So the protective lining, mucus and buffers in your GI tract is not enough to fight off the acid. So you'll have erosion, and then once it gets down to the muscle and starts bleeding, that's when people go and get some help. You can get ulcers from mouth to anus, but usually where there's a lot of acid. Gallstones, so lith is stones. So you have cholelithias. This is the presence of. And they say passing stones for men is like childbirth for women. So super painful. So there are options. Option number 1, drogas. So hopefully the medication or whatever they give you dissolves them, smaller stones, and you can just pass them. Second, we use sonic waves. So they'll put you in water and they'll hit you with sonar, sonic wave, and then hopefully that shock will break the stones and then you pass them. But if that doesn't work, lithotripsy. They're gonna go in with an instrument, crush the stone, and remove them. So tripsy means to crush. So you have a lithotripsy, and that is worse. So sometimes it's diet. It could be proteins that's causing it. It could be minerals like calcium. So modify your diet. Sometimes they'll go away. Hepatitis. So 4 types. There's more than 4 types now. A, B, C, and D. So A, as you guys recall from our blood chapter, that's water. Water soluble, water infection, waterborne, and then the rest is bloodborne. To eliminate D, it's easy. Don't get B. You have to have B in order to get D. So what are some risk factors of hepatitis? Unprotected sex, needles, not the results, not what happens. We know what happens, right? It leads to SCLAR, sclerosis, so hardening, and then that can lead to cancer. Other disorders, inflammation, colitis, or Crohn's is like severe. Just imagine you ate a handful of poison ivy leaves and the reaction your colon would have, right? All inflammation. And imagine that all the time. You just eat regular food and your intestines get that inflamed. So life expectancy is not very long for patients with Crohn's. Progressively gets worse. Right? So just imagine that entire large intestine is just allergic or reacting to like a poison ivy. Diverticulitis. So diverticulum is an outcropping. So you get these little patches. Sometimes they'll get infected and become very painful. You have to modify your diet. You don't want to eat anything with small seeds or parts that might get lodged in the opening and it'll cause an infection. You guys heard of varicose veins, right? On your legs. So they're just engorged, open. So if they're in the anus, then they're called hemorrhoids. What do you use to reduce inflammation of hemorrhoids? Yep. So preparation H is a vasoconstrictor. It just gets those blood vessels to shrink a little bit. They can perform surgery if they need to. for hemorrhoids. All right, some terms. So we are puncturing into the abdomen. Here we're puncturing into paracentesis. Next to tomy. What's tomy? The process of cutting into a gallstone. So this is the process of cutting into a bile duct stone. So Dolch just means the duct or the vessel. Trypsy, crushing, the process of crushing bile stone or a gallstone. Surgical repair of, what are we fixing here? Lips, surgical repair. Here we are stitching the tongue. So if you want to put that patch on, that tongue patch, stitching the tongue. Here we are surgically repairing the esophagus, surgically repairing the anus. Right? What are we doing here? Glossectomy.
Taking out the tongue.
Yep, removing the tongue. So if you have cancer from tobacco use or chewing. Right, digestive system, not too bad. Let's continue on with the urinary system.